The next case is a female 27-year-old, and the chief complaint is this bump has been growing on my gums. In the background in patient history, she has asthma. She's taking albuterol as a medication. Now, the current finding is a raised 5 into 5 millimeter erythematous edematous mass on the papilla between teeth number 27 and 28. Now, the question is, the lesion indicates the need for a diagnostic workup of which body system? Is it endocrine, cardiology, pulmonology, or renal? So let's find out. Now, this patient is a female and in her productive age, so most probably she's having pyogenic granuloma. The next big clue was the erythematous and edematous lesion that was seen between the interdental papilla. So we would need the diagnostic workup of endocrine system because these lesions frequently arise during hormonal fluctuations. So remember, pyogenic granuloma is an exuberant reactive hyperplasia of granulation tissue that is located on the gingiva. These are raised red raspberry-like mass, most common on gingiva. It may be ulcerated. Also remember that pyogenic granuloma is most frequently found in young women who is pregnant. Even though this patient was not pregnant, still pyogenic granuloma can happen in any young woman. The option B was cardiology. Now, this patient exhibits no cardiology related issues because nothing is mentioned in the question. That is why it is not necessary to investigate cardiology department. Therefore, we don't need any further investigation from the cardiology department. The option C was pulmonology. Now, this option is a trap option because this patient had asthma, right? So, despite the patient having asthma, there is no requirement for pulmonology checkup because this gingival lesion is no way related to any pulmonology issue. The fourth option was renal. Obviously, no renal complications were mentioned, so the patient does not require any nephrology evaluation. So remember, a pyogenic granuloma is an exuberant reactive hyperplasia of granulation tissue on the gingiva, and these lesions commonly occur during the times of hormonal fluctuation, most commonly seen in females. See you in the next one.